Well, welcome to Real People, Real Voices. I'm your host, James Jackson.
I'm the co-host, Pastor Wayne Moore.
Always a pleasure to host with you.
It is, man. It's always a pleasure to be able to address the community about certain issues. And right now, the issue is COVID-19.
It is. And we're going to be joined by the wonderful folks from Marion County Health Department. But first, our sponsors.
Yes, Tamiko Associates Realty Group is with us. Not only her, but we have Martin University, Marion County Public Health Department, Owl's Modern Clothing and Shoes, His Place, Eatery, and we have Lee Cossell and Crawley. We have Fervent Care Christian Academy, but last but not least, North Side Window and Gutter Cleaning. Thank you, sponsors.
All right. And for those of you who perhaps want to get the information from this show when it's all over and other shows that you might have missed, you can do that by going to WHMB TV 40 on YouTube and
like us on Facebook. We're there.
Yeah, join other folks who are on Facebook, and it's just a wonderful experience. We've got some great things to share with you on today, so don't go away. We'll be back after these messages. Welcome to Real People, Real Voices, and we're joined by Christine Brooks, who is the project liaison for Marion County Public Health Department. Welcome to the program.
Thank you. Welcome. Thank you for having me.
It's good to have you with us on today. And of course, we are still in a global pandemic, although many people are kind of doing things as if we weren't. Give us an update as to how things are going from the perspective of the Marion County Health Department.
Well, as you know, we are still in the pandemic, and we like to stress for individuals to keep doing what they've been doing to make sure that the cases are staying down by taking all of the preventative actions of wearing a mask, social distancing, and everybody should go out and get vaccinated if it's your age eligibility group.
And where are we with regard to age eligibility currently?
So currently we are at individuals that are 40 plus. The state added the 40 plus category yesterday. And just a friendly reminder for those that have an upcoming birthday, if you are 39 and 8 months, then you can go ahead and register. So anytime they reach an age category, as long as you're within that, within 4 months of your birthday, you can go ahead and register through Zotec, through the ourshot.in.gov. They'll accept it.
Outstanding.
And so we are actually also, we still have our COVID testing sites going on. And we have our vaccination clinic for Marion County Public Health Department on the west side. We are in the process of working on the logistics for a new site that will be on the east side. I don't have the information yet, the finalized information yet for the exact location and all of that.
That is phenomenal. That's phenomenal, Ms. Brooks. I tell you, I watch the dashboard every day. Something has troubled me on the dashboard, and that issue is it's not a data issue you can't handle. It's a data issue you can handle. It is the by race number. Mm-hmm. The white race is 67.9%, and all other races are we only have are pretty low. My question is, what's going on in that particular community, opposed to other communities, that this number is stagnant?
So are you're referring to the number of people that are vaccinated?
I'm referring to the number of cases by population.
Oh, but the cases. Okay. So, because you said a low number, so I wasn't sure. I wanted to make sure that.
Yeah.
So, as far as the number of cases in the community with COVID-19, we do find that it is hitting the communities of color more harsher. We don't know exactly all the reasons. A lot of it has to do with underlying conditions and access to care, but there are a multitude of factors that go into play with that. So I can't really say
I was just
definitely
curious.
why.
I was just curious because every morning I look at it and I see in the white community it's 67.9%. In the Afro-American community, it's only 6.7%, and that is statewide.
6.7% as far as the number you're referring to?
Yes, ma'am.
The number of cases or the number of the
cases
percent?
by race. Cases
by race.
Yeah.
Okay. Yeah.
That's all. And I'm just wondering, I've been watching that number, and both numbers have been stagnant for a while. My question is, are we stagnant? Are we experiencing some stagnicity in this process?
As far as the number of cases that are being tested for positivity, or are you saying that we're not sure? We're not sure if there's a reason why we're in the situation that we are in as far as the plateau.
Okay, that's what I'm talking about.
There came up a conversation the other day where our person in our epidemiology department was talking about it. There are so many factors that go into what's going on in the community as far as the testing, as far as the activity that individuals are doing, and how everybody is going with taking the precautionary measures. And so we know that the testing is down, but we also know that people are doing what they're supposed to do. There are still some people that are not doing what they're supposed to do. And then we have some events going on, and there are occasions where people are not wearing their masks. We don't know how much of an uptick we will see from everything that's happening within the community. People are traveling more, and people are going outdoors more, going to events. We do have some social gathering events that are going on. We also have March Madness going on, and occasionally there are some issues. We get complaints called into the call center about people not wearing their mask and all of that. So to say that we do have an increase in cases every day, a case here, a case there. We monitor those every day. But as far as a surge, if that's what you're asking about, we're not sure if there's going to be a surge or not, especially with what's going on. We hope that there isn't, but we'll just have to wait and see because of all of that activity. One of the other things that we're taking a look at is we're keeping a close eye on the variants that are in the community. That's why it's so important for people to go ahead and get vaccinated. There are a lot of hesitant people out there, but they really do need to get vaccinated. The more people we get vaccinated, the closer we get to every step to getting to herd immunity. So.
I call it community immunity. So.
Okay, you can call it community immunity.
Let's start with these communities first. If we can get community immunity, then we can get the herd community. So, what I mean by that is if we can just get people in all communities to get this vaccination, we can have the herd that you're talking about.
Right, and that's what's really important. That's where that helps with fighting against the variants that are out there and all of the other things that could happen. So it's really important.
Thank you, Christine. Good information. We're about a minute 45 from break. When we come back, we would like to hear from you on two things. One, people say that they don't want to get COVID by getting the COVID-19 shot, and we want to hear what you have to say about that. And then secondly, can you still get COVID-19 after you are fully vaccinated? Stay with us. We'll be back with more after this. Welcome back to Real People, Real Voices. We're glad to have you all here. We're joined by Christine Brooks, Marion County Health Department Project Liaison. Just before the break, interested in knowing about people saying, well, I don't want to get COVID by getting the shot. And second to that, if you get the shot, and I'm fully vaccinated right now, can you still contract COVID-19?
So to answer your first question, you cannot get the you cannot get COVID-19 from getting the shot. It is not a live attenuated vaccine. It doesn't have the virus, the true live virus in the vaccine. And so a lot of people are confusing that with a long time ago, they used to have vaccines where they had the live virus in it.
Mm-hmm.
This has sort of like a duplicate of the virus. And it is only in there to trigger an immune response in your body. So people are concerned that when they go get the shot, that they suffer some symptoms. They might see minor symptoms, runny nose, a fever, and muscle aches in their arm, especially where they get the vaccine. But they should not be seeing a lot of the other major symptoms of COVID, the coughing, and if they have a really high fever, they may get some slight fatigue, but it shouldn't be anything major, and it shouldn't last. It usually lasts somewhere between 24 to 48 hours. If it's lasting longer than that, then they might want to seek some guidance from their primary care physician or whoever their medical provider is, as well as they might want to go ahead and request to get tested, set up an appointment to get tested. But it just depends. So, yeah.
We cannot abandon the ideology of testing just because we have the vaccine in our communities. We still got to get this testing done.
That is correct. And then for those that get the vaccine and they, you can still get COVID-19. The issue for the vaccine is it's supposed to be a preventative measure of preventing severe disease and death. And it's sort of like the flu shot. You get the flu shot, but you still may get a mild version of the flu. Every year you get the flu shot. So the COVID-19 vaccine is the same thing with that. We want you to take the shot. You might you might not have no response to getting the virus, but you may have something. It depends on when you are exposed to someone, because a lot of people need to make sure that when they get that shot, they don't go out and they forget about the fact that you still need to be wearing your mask.
Mm-hmm.
You need to be social distancing. You need to make sure that you're not around somebody that is COVID-19 positive. If you are exposed to someone after you get your first shot, then you need to quarantine to make sure, but also you need to be monitoring for symptoms as well. But the most important thing is just try and do what you're supposed to do with the preventative measures and prepare for your second shot. And then after you're 2 weeks out from your second shot, your immune system should have built up in your body to be able to fight off a severe COVID-19 infection.
Wow, that's good stuff. I mean, how is the? I don't know if you could answer this. Are people finally getting to the place to where they understand the seriousness of taking the shot?
There are a lot of people that I've talked to that at first they had some hesitancy, and then they decided, after seeing a lot of the people go out and get the shot, and that especially the ones that think, I get the flu shot and I get sick every year. So now that they see that people are getting the shot, and they may have some minor symptoms, but there are a lot of people that don't have any symptoms at all. And a lot of times you see more people with symptoms after the second dose, if they're getting the second dose. We're still kind of in a wait and see pattern for the Johnson & Johnson because it's just gotten out there. Yeah. So, but for the most part, a lot of people don't get a lot of symptoms. So.
Okay, that makes sense. Go
right
ahead, Jack.
With regard to people getting registered for the vaccine, is so important that as many people who would get vaccinated would do that. and also making sure that you get your second shot after you get the first one. But how can people who are watching go and get their shots or go get registered today?
So they can either call 211, which is the resource services for the state, or they can go online to ourshot.in.gov and go through the registration process. They need to make sure that they meet the eligibility criteria of either if they're the healthcare workers or first responders or anybody in the special category of if you have special underlying conditions. Now, if you have the special underlying conditions, you should receive a special link from the State Department of Health through Zotec, because your primary care physician or your medical provider or whoever your treating physician is should be in contact with the State Department of Health, and they should have notified them of your condition, and therefore then the State Department of Health sends you a link through a special Zotec link in order to go ahead and register. And then when you show up to the vaccination clinic that you choose when you register, then they should have all of that information on file that you, even if you don't meet the age criteria, that you have that special underlying condition that qualifies for you.
And some people are saying that, of course, I had my second shot, Moderna, last Wednesday. And then last Thursday, I had chills and I was very tired. Last Friday, I was doing great. Everything was fine. And so people are encouraging people to take pain medication and different things like that before they go get their shots. Do you all have, well, I guess, I don't know if you can speak to that or not. I didn't take any pain medication. I didn't want any interruptions or anything, but.
So what I can say for that, being not a medical provider, is the CDC has put out some information that they can go onto their site and look at as far as some of the pain relievers, but they should also contact their medical provider, their primary care physician, if they have some situations where they want to take a pain reliever or ibuprofen or something like that. Because what happens is there are some concerns that if you take that medicine before you have the shot, then you have the shot, and the shot is all about having your body react to the mRNA that's in the shot, and to develop that immune response and build up the antibodies. So they're saying that if it's possible, they don't know for sure, if you take like ibuprofen or something like that, it kind of keeps your body from doing that complete immune response, and you might not have enough antibodies if you are exposed to the COVID-19 virus.
Let me add something there. This is a new piece to this, Brother Jackson. I know you probably heard, and Christine can give us more insight on it. Tell us now about the phase of in-home vaccinations.
We've got about 30 seconds left.
Oh my God.
Oh,
we may have to come back to talk about that piece.
Sure, no problem.
You've been a great guest. We appreciate it. Please extend all of our best to Dr. Kane and all of our folks there at the Marion County Health Department. Thank you so much.
You're very welcome.
Stay with us. We'll be back after this. Welcome back to Real People, Real Voices with The Rundown. I'm James Jackson, your host.
And I'm your co-host, Pastor Wayne Moore.
And I'm Curtis Baker. How you guys doing?
Doing
Been
good.
a minute.
Doing pretty good, man. The Lord is taking care of us in the midst of COVID-19. And I'm telling you, man, we had a great show today.
Had a great show. Great guest. She had a lot to say. And I tell you what, we have to bring her back because there's a lot of information that we still need to cover. So, hey, real quick, who's been vaccinated?
Oh, well, go right ahead, brother.
Hey,
all right.
You know what? Didn't feel a thing.
Is that both your shots?
Both my shots, had the Pfizer shot. First shot, nothing. Didn't feel nothing. Felt like a mosquito bite. Second shot, I didn't even know she stuck the needle in me. So this has been 6 days since my second shot. No symptoms, no reactions, no pain, nothing. So people, get your shot, take it now so we can come out of this and we can have 4th of July, Christmas, Thanksgiving. We can get back to doing the things that we want to do. And I got to get to Kokomo so I can hug my Aunt Jeanette. That's why I got my shot.
Yeah,
I want to hug again.
Ms. Aunt Jeanette, we love you right here on Real Voices.
I got a big hug coming.
That's good, man. That's good. We're going to get there. If we can get this community immunity together, we're going to be all right. Then we can get into herd immunity. Get these communities straightened out, man.
Right.
And we can put it all together and make it work.
Christine,
go ahead.
I'm
sorry. It's funny you said we got this song we're going to play during this. You could probably hear it now. From Rodney Steps playing. So you guys will really get into this. So Dr. Moore, thank you for that.
Oh, so you took something. Oh,
you asked.
You going to play it now?
It's playing right now.
Oh, yeah, get to vaccination. I'm a part of the nation.
There you go.
Yeah.
That's what it's all about. Christine gave us some really great information. And a lot of times people think, they got this vaccine so fast. But what we weren't able to get to is, of course, we did establish that it's not COVID-19, giving you COVID-19. But the infrastructure for the vaccine has been around for 10 years. It didn't take them long to replicate the DNA or the the information they needed. So they were able to put this all together in record time, because it usually takes much, much more time, as we understand it, to develop a vaccine. So
and adding to that, glory. Yeah, and adding to that, Pastor Jackson, is the logistics and distribution of it here. In the last, I would say, less than 100 days, millions are being vaccinated now. Based on what we were told prior, this administration has moved, expediently to move this vaccine throughout this country. And it seems to be working. We're not where we need to be, but we are just a little bit getting where we ought to be. And so that's what it's all about. And hopefully people will join the vaccination nation.
Save your life.
The shot makes it happen.
And it's not the mark of the beast.
No, not the mark of the beast, my brother.
Not this.
We ought to stop blaming Jesus for everything.
Right.
Now, he can do anything, but some things we've done that we ought not to blame him for.
And we'll let that be the last word. Thank you all for joining us. We'll see you next time.
Don't be afraid to get the vaccine.
Take it from us. Give it a shot.
Join the vaccination nation today.
Join the vaccination nation. It could save your life.